Your body has a system to keep your blood vessels narrowed, increase salt retention and water to maintain the blood pressure in case of emergency situation such as traumatic bleeding and at other times. This system is called the renin-angiotensin-aldosterone system or RAAS. When the blood pressure increases with age due to overreaction of this system, there are counteracting drugs to minimize this situation. We are discussing today about angiotensin converting enzyme inhibitors or ACE inhibitors, drugs used to maintain a normal range blood pressure. You may be taking angiotensin converting enzyme inhibitor or ACE inhibitors or angiotensin receptor blockers or ARBs for high blood pressure prescribed by your doctor. These drugs are differentially used in elderly patients with hypertension. High blood pressure should not be ignored in elderly people because it is associated with cerebrovascular, cardiovascular, renal issues and mortality. Blood pressure must be reduced according to the needs of the patients based on age, race, severity of hypertension, coexisting medical problems. Coexisting medical conditions like asthma, diabetes, heart failure, renal failure, gout, coronary artery disease, hyperlipidemia, and peripheral vascular disease are major determinants for the selection of antihypertensive medications. Angiotensin-converting enzyme or ACE inhibitors are not only efficacious antihypertensive agents in the elderly, but also appear promising in counteracting some of the cardiovascular and renal consequences of hypertension. They are well tolerated and have a low incidence of adverse effects. ACE inhibitors possess ancillary characteristics that are potentially beneficial for many elderly patients, including reduction of left ventricular mass, lack of metabolic and lipid disturbances, low adverse central nervous system effects, no risk of induction of heart failure, and a minimal risk of orthostatic hypotension. So that would be the first line of drugs doctors will prescribe for older people. Since ACE inhibitors may improve perfusion to the heart, kidney and brain, they are well worth considering for the treatment of elderly patients with hypertensive target organ damage, especially in patients with heart failure and diabetic patients with early nephropathy. Now, what is angiotensin 1? Let us talk about angiotensin first and proceed to drugs that blocks it later in the discussion to reduce your high blood pressure. Angiotensin is a peptide hormone that causes narrowing or vasoconstriction of arteries, causing increased blood pressure. It is part of the renin-angiotensin system which regulates your blood pressure. Now, what is renin-angiotensin system or the RAAS system as it is called? It is also called renin-angiotensin-aldosterone system or RAAS. This system is a critical regulator of blood pressure, including blood volume and electrolytes balance. Normally, renin secreted by the special cells in the kidneys if blood pressure is too low, thus activating angiotensin 2 to increase blood pressure and vascular resistance. I shall repeat that. Normally, renin secreted by the special cells in the kidneys if the blood pressure is too low, thus activating angiotensin 2 to increase blood pressure and vascular resistance. Angiotensin II derived from angiotensin I by an enzyme secreted in the walls of the blood vessels called angiotensin converting enzymes. When your blood pressure drops too low or your body does not have enough salt, renin gets sent into your bloodstream. That triggers a chain reaction that creates a hormone called angiotensin and signals your adrenal glands to release another hormone called aldosterone. Angiotensin also stimulates the release of aldosterone from the adrenal gland that sits on each kidney like a cap, promoting retention of sodium by the kidneys. In short, angiotensin, by narrowing arteries and retention of salt, helps to maintain normal range blood pressure and fluid balance in the body. This is a natural event when people are traumatized to minimize the rate of bleeding for survival. The precursor of angiotensin is a protein called angiotensinogen produced in the liver. Angiotensinogen broken up by renin, an enzyme produced in the kidneys as mentioned before to form angiotensin I. As the blood passes through the lungs and kidneys, further metabolized to produce angiotensin II by the angiotensin converting enzymes. Angiotensin converting enzyme is produced by the vascular endothelium or inner lining cells to help regulate blood pressure. Its catalysis, meaning accelerating the conversion of angiotensin I, an inactive protein, into angiotensin II. So let's summarize what we have learned so far. Liver produces angiotensinogen. This is broken down to angiotensin I by hormone renin secreted in the kidneys. Now the angiotensin converting hormone secreted in the inner lining of arteries converts angiotensin I into angiotensin II. Angiotensin II raises blood pressure by several actions, the most important ones being vasoconstriction or narrowing of blood vessels. Now let us talk about angiotensin converting enzyme inhibitors. These are drugs that cause dilatation or relaxing of blood vessels by inhibiting the production of angiotensin II. These are drugs used to treat high blood pressure, heart problems, and other conditions. The major organs that ACE inhibitors affect are the kidneys, blood vessels, heart, brain, and adrenal glands. As I said earlier, ACE inhibitors or angiotensin converting enzyme inhibitors work by primarily relaxing the blood vessels. On the other hand, angiotensin formed by breaking down of angiotensinogen produced in the liver cause narrowing or vasoconstriction of blood vessels. So ACE inhibitors are used in the treatment of high blood pressure. Those ACE inhibitors come in various labels such as capoten, monopril, enalaprilat, gestrel, lotensil, ecopril, lisinopril, and so on. And your doctor would have prescribed one of those drugs which you take for high blood pressure. ACE inhibitors act by stopping the action of an enzyme called angiotensin converting enzymes described earlier as produced by the inner lining of blood vessels. Angiotensin converting enzyme signals the protein in the body converting angiotensin I to angiotensin II. Angiotensin II narrows blood vessels and contributes to salt and water retention in the body, which increases the blood pressure as mentioned earlier. ACE inhibitors have side effects you should be aware of if your doctor has prescribed it for you for high blood pressure. They are dry cough, low blood pressure, fatigue, dizziness, headache, loss of taste, and skin rashes. If you get any of these side effects, remember they may be due to your ACE inhibitors. There are more serious side effects too: swelling of the area beneath the skin, increased potassium levels in the blood, renal failure if you have narrowing of renal arteries. They may be harmful to both mother and the baby if taken during pregnancy. And lastly, chest pain and pancreas gland swelling. Please see your doctor if you get any of these serious side effects. Hope this video article was useful. Wear your mask and keep your social distance in crowds even though you have had both vaccines. Goodbye for now.